Welcome back. And I'm here with Dr. Itzkowitz, and thank you so much for taking time out of your day to be with us today. I really want to learn about this room and hear about all this equipment, but first I want our viewers to get to know you a little better. So tell me about your experiences, your education, and your background.
So I'm a board certified gastroenterologist. I did my fellowship at University of California, Los Angeles. I've spent 21 years active duty service in the United States Navy, where I was a former chief of GI at Walter Reed National Military Medical Center in Bethesda, Maryland.
Wow.
I most recently have been the department head of gastroenterology at Naval Medical Center Camp Lejeune, and before joining Novant.
Wow, that's great. What credentials you have, and we're so happy that you're here in our community and being able to provide services to our residents of this county. So I know that you've recently joined Novant Health Gastroenterology, correct?
That is correct.
Great. And are you one of the physicians who will be seeing and doing procedures here at the Endoscopy Center?
Yes, I will be.
Perfect. So tell me a little bit more about the services that you all will provide.
So we're planning in this unit particularly to be providing both screening and endoscopic procedures for symptomatic patients, both upper endoscopy and colonoscopy.
Okay. Well, let's talk a little bit about what we're seeing here in the procedure room. Let's talk about the equipment.
Yeah, so it's state-of-the-art equipment. We're starting at the head of the bed here that our endoscopic providers will be providing MAC propofol sedation. This is all the anesthesia equipment that you're going to be seeing. Patients will be on their sides on the stretcher here. Endoscopic equipment, state-of-the-art Olympus equipment, the best equipment made. These are the processors, the light sources that put light through the scope so that we can see inside the body, and monitors both for the staff and monitors for the provider providing the service at the time. So.
When we were in the room next door where the equipment is cleaned and sanitized, and they talked about it being passed through.
Correct.
And it would be behind a locked door here and a positive pressure. Is that the locked unit back there?
Yeah, that is the locked unit. So, we're going to follow the most state-of-the-art infection control techniques that are currently recommended by national societies.
Wonderful. Infection control is so important, and I said to Lynette, this is kind of like the operating room in the hospital. It has the same sort of technique and procedures that we utilize to keep the infection down.
That's correct. Yeah.
Good. So one of the most common procedures, I would assume, would be the colonoscopy that would be done here. Remind me about what the recommendations say about how soon you should have one and how frequently should you have them.
Yeah, so for average risk individuals, particularly Caucasians, average risk colon cancer screening is recommended to start at age 50. For those who are African American, we recommend starting screening at age 45 because African Americans actually have more advanced polyps and earlier cancers. So it's one of those things that's not very well known out in the African American community, and it's one of those things that we want to stress to our viewers. Our surveillance and screening recommendations will then be made after that incident procedure. Most will then have follow-ups either 5 or 10 years.
I see. And then if there is some significant findings, probably more frequently than...
Potentially, or if there are genetic syndromes that are found and other things that make surveillance intervals a little different than the average patient. Yes.
So are all patients a candidate for an outpatient endoscopy center? Would everybody be able to have that, or are there some patients who might need to have their procedures in the hospital?
Yes, so that's a good question. So actually, there are actually screening things that we go by to determine where patients are best served. So those patients who are deemed uncomplicated based on scoring systems will be done here in this outpatient unit. Those that are deemed more complicated will continue to get their services at our inpatient unit at the hospital.
And since you will always see the patients prior to the procedure in your office, in your gastroenterology office, that would help make that determination. Is that correct?
That is true. Although I will tell you that there is going to be a plan ultimately to potentially do what's called open access colon cancer screening, where there'll be algorithms determined to help get patients in without that preclinic visit. That'll make it much more effective and productive and an efficient system. We're working to that. We won't start with that at the initial opening of this facility, but we hope to get to that at some point soon.
Yeah, I know that in some facilities that is sort of the way to go. Well, that makes sense. But it sounds like that the majority of the patients probably would be able to be a candidate for the outpatient center.
That is true.
Yeah. Well, before we leave this room, is there anything else that you would like to add?
I would just say that this is a fantastic facility. I think that our patients and colleagues out in the community will benefit from this facility, and we're happy to provide the highest level of care at the facility. So.
I love the facility, the convenience of the facility. The parking is wonderful. There's no traffic. We don't have to go across the bridge. And I think that the access is just much better for the patients here rather than at the hospital.
I would agree. Yeah,
it's just much more comfortable.
Yeah, I think so. I think we're going to find that it's going to be an overall good experience for our patients.
Yeah. Well, thank you so much. It's been a pleasure to have you on the show. And now we're going to head over and check out the new Novant Health Gastroenterology Brunswick, where I believe your office is.
Yes, I think so. Thank you.
Great.